Oh my gosh, bro. We are reacting to a video called Hand, Foot, and Mouth Disease Viruses, Pathophysiology. I don't know how you say that. Signs and symptoms, diagnosis, and treatment. Guys, I wanted to say I'm changing out my content. I'm going to be doing gaming videos next year, 100%. So I'm not going to be doing ASMR on this YouTube channel. There's a whole new channel called Nightboy ASMR, NITEBOY ASMR. No spaces. And I am going to be cutting down the reading videos. And I'm not sure. I might not be doing any more reading videos forever now. Not for the rest of this year, and maybe not for some of next year. I just don't have the motivation to read. I don't get enough views, which makes me feel like I'm not doing a good enough job of making you guys happy. And I'm not doing it for the views. I only like the views because then I feel like I'm making other people watch my videos more, and I'm helping them out. Is why I think I get views. Is why I'm helping people out. But they haven't been doing that. So that means I felt like I haven't been really doing much. So that's why I'm not doing them. So I'm going to be doing reaction videos to either health videos or Fortnite videos or whatever. And yeah, you know the name. We're also going to be doing some Fortnite videos, health videos, and much more next year. And it's basically we're reacting to videos this year too. And then I might decide to do some next year if they don't get copyrighted. So yeah. That's my new content. I've decided it already, and this entire channel mainly was based on me just trying to find a content idea. So this channel is not going anywhere. Don't you ever think it is, because it's not. So we have timestamps. This is almost a 10.5 minute video. It's 10 minutes is 27 seconds.
This lesson is on the condition known as hand, foot, and mouth disease. Hand, foot, and mouth disease is an infectious disease that causes a rash on the hands, feet, and mouth. This is why we call it hand, foot, and mouth disease. Now,
okay, see, this is what I'm talking about. This looks like strep, in my opinion. I'm not an expert, so I wouldn't really know, but that kind of looks like strep, in my opinion. Because, like, look at that. If you zoom in right now, can't you? Oh, got raining in my ears. Shit. But yeah, see, that right there looks like, in my opinion, not gonna say anything, but that looks like strep or another bacterial infection that goes in the throat, and that looks like sepsis. That's just my opinion. I can't be too sure if that's what that person had, but I'm just being honest. I think that's like sepsis or strep or something.
Hand, foot, and mouth disease is a viral infection, and it's most commonly caused by the virus known as Coxsackie virus A type 16 or
Coxsackie virus? Like Coxsackie virus? A type 16. Coxsackie virus. That sounds so wrong. Okay.
CVA16. And CVA16 is a positive sense single-stranded RNA virus. Although most cases of hand, foot, and mouth disease are caused by Coxsackie virus A type 16, there are other viruses that can cause this condition as well, and these include Coxsackie viruses A5, A7, A9, A10, E2, and E5 strains, along with intravirus 71 or EV71. Intravirus 71 or EV71 is an important virus to point out because this can cause a more severe illness, and we're going to talk about some of the complications and severe symptoms that this particular virus can cause in hand, foot, and mouth disease. And intravirus 71 seems to be more common in Asian countries. And it's also important to note that patients can also be infected with multiple of these viruses at the same time.
So what? So you could have Coxsackie virus A5, A7, A9, and enterovirus 71 at the same time. It depends. With me, here's the thing. To me, none of these are even scary. Okay, yes, that would scare the hell out of me if my throat and my hands looked like that. Personally, the thing that would scare me more is either cancer or heart attack. Those are the only really big things that would scare the hell out of me. Those are the only mainly two, or no, vomiting blood. That's probably the only three that would, vomiting too, and probably like intestinal rupture. The only 5 things that actually would scare us. Oh yeah, video should be popping up there of me talking about intestinal rupture. You guys should check that out. It's pretty gross, but I think you guys should watch it. But yeah, I'll just say it because like if you could get Coxsackie however you say it, A5, A7, enterovirus 71 at the same time. I don't know, bro. That sounds pretty fishy. I mean, that sounds pretty dangerous. Because they said that one right there can cause some serious symptoms. What about the other Kakisaki viruses out there? Like A5, A7, or all these A viruses, bro. That could cause way worse of a virus. And hell, if the fucking enterovirus 71 is already bad, then heck, how can you react to all of these? Saying you can have multiple of the same virus type. Like, that's insane. Okay, yeah. Maybe a heart attack's more fatal than this shit. I'm putting that out there. I'm being honest. Heart attacks are fucking 10 times worse, more dangerous than Kakisaki virus A type 16, CVA 16. It's way worse. I think we can all agree and establish that through the court of law that heart attacks are a lot worse. Because Kakisaki virus cannot kill you. I mean, it can kill you possibly, making your throat look like it has egg sacs in it. But I mean, hell, look at my skin, bro. It's yellow. It's the light reflecting on it. The light keeps reflecting on it, makes my skin look yellow. But in reality, it's actually just red and white, like it's supposed to be. But yeah.
Hand, foot, and mouth disease occurs worldwide. It has a worldwide distribution. And it affects, most commonly, children, and especially very young.
Then why the hell you have adults? Why the hell do you have 2 adults out there if it's for kids? So it occurs worldwide. So that's something to take in consideration, that this occurs worldwide. So that means it basically affects not mostly everybody, but can affect everybody. And it affects children under the age of 5 and 10, mostly common affected. So it's mostly common affected the ages of 5 and 10. So I guess it would be just common for the other ones?
Children under the age of 5 to 10. But having said that, this condition can infect adults as well. And because children are the most common...
So that makes sense. So we've only 1 minute 30 seconds in here. And how long have we been doing this video? 7 fucking minutes. And we're 1 minute in. Fuck, bro. This shit's not even fucking... God darn it, bro. Alright.
Commonly affected group of individuals that get this condition.
Oh, shit. Okay, so daycares get it, summer camps, and within families. So families can spread it. Okay, I guess so, because if a kid has it, they can give it to the adult. And then the kids will go to summer camp to give them to those kids, which then, if they had a sister that goes to daycare, then the kid that had it can give it to the little sister that's only in daycare, and she can have it while giving it to the other people in daycare, and it causes whole foot, hand, mouth disease all at the same time. That's insane.
To see a lot of cases of hand, foot, and mouth disease are going to be in daycares, summer camps, and within families. There's going to be a lot of what we call horizontal transmission between children to children. But as mentioned before, in more rare cases, children can pass this condition on to their parents as well. And we can see increased cases of hand, foot, and mouth disease at particular times of year, especially in the late.
To me, this doesn't seem... Okay, look, I'm not saying it ain't severe, but there's so many worse things out there. I'm gonna name them. Anaphylactic shock. There's hypovolemic shock. There is... So, I don't know. Can this cause hyperhidrosis? I'm just asking a question. Alright, if there's a symptom of hyperhidrosis, I'm gonna be very, very surprised if this could cause hyperhidrosis. Because whenever I thought my palms really, really are sweaty, which they called it hyperhidrosis. So for the past couple of days, I've been logging up searching hyperhidrosis, and one of the symptoms, or one of the causes of it, could be a heart attack. So again, I'm not having a heart attack. I'm still fine, ain't I? Heart attacks are not common in kids, but can happen. You have to have mainly happens with a heart defect in kids, which even a heart defect in kids can be a little bit rare too. So it's super rare to have one. But again, you're scared of it. Go get it checked out. It's pretty common sense. Hold on, guys. I'm getting fat. I don't know why. Alright. So, again, there's many other serious things out here in my opinion. This looks like strep. So, I don't know why they're saying hand, foot, mouth disease, HFMD. This looks like strep. Or if this person is on like 10 cans of Coke. Actually, no, not like that. I meant actual Coca-Cola. You know, and I didn't mean that. Guys, I don't mean that. Okay, that looks like he drank 5 cans of Coca-Cola and never burped. That's what I think. Now, of course, I don't know what that's like, but having 5 cans of Coca-Cola, now I know I shouldn't put Coca-Cola in there, not just Coke, because that means a whole other thing. But I'm saying 5 cans of Coca-Cola, I'm pretty sure that can cause your throat to look like that. Or if you've yelled every single day over a football game for 7 months straight. That's exactly what that looks like to me. Now, I don't even know if that's what happens, but to me that looks like that's something more serious than hand, foot, and mouth disease. But of course, we're 1 minute into this video and about 11 minutes into this video, but 1 minute into the actual video. But in this video that I'm video recording, we're in like 11 minutes. So, it's gonna be like a 30-40 minute video. Let's get to it.
Summer and early fall.
Alright, wait. I meant septic shock is another one. Hypovolemic shock. Anaphylactic shock. There's cardiogenic shock. There's cardiovascular shock or cardiogenic. Yeah, I just said that. Forget it, not cardiovascular. There's other ones too. There's hypoglycemic shock. So, like, at the same time, there's shocks that are way serious than this. There's sepsis, there's seizures, there's tonic seizures, whatever you know, and there's even blood clot in the lungs that can kill them faster than hand, foot, and mouth disease. I mean, I don't want this. I'm not saying this ain't dangerous. Okay, we've only 2 minutes into this, but let's just continue because I don't want to make this too long.
Or early autumn. So we can see peak in case numbers in these particular times of year. And in some parts of the world, we can also see a cyclical pattern occurring over multiple years where we see outbreaks occurring every 3 to 4 years, for instance. So this is also something to make note of as well. So how do individuals transmit and become infected with this condition? So the viruses that cause hand, foot, and mouth disease are going to be transmitted by bodily fluids. So it's going to occur via contact with bodily fluids, either from oral secretions or nasal secretions, or from fecal material, and we can also see it.
What the fuck? Bro, are you saying they eat their own poop? Okay, I don't even know. I might be thinking something else, bro. That's nasty, bro. So what, you mean like you could contact that by kissing or whatever? I mean bodily fluids. Who's gonna go in someone's mouth? The fuck? So what, I guess the intestines get infected, then infects the lungs and the GERD and... I don't know. I mean...
From respiratory droplets that become aerosolized. And all of this can occur via direct or indirect mechanisms. So direct meaning that if one child is infected, they can directly transmit the virus to another child, so they could be closer to that child, and there could be respiratory droplets or oral secretions that the other child ingests or gets in contact with their respiratory or oral mucosa and get infected directly from the other infected child. Or it could be indirect, meaning that there's an infected child that touches objects in the environment, could be furniture, could be toys, and then they leave the environment and another child comes into that environment, touches those same furniture or same toys that contain the virus, and then...
So wait, so it's like anything is possible with this fucking thing. So HFMD, so FHMD, hand, foot, mouth disease. What I'm getting at is, your hands, your feet, your mouth all gets infected with this. Now, I have a theory that this can cause, which we'll have to see, which are the symptoms. Oh, there's complications. But I guess there'll be more to this. But yeah, so I'm only gonna say my opinions right now, and then we'll finish watching this. And then when there's good parts, I'll stop at it instead of doing this. So I'm getting at, there is What I'm getting at this, I'm gonna give my own theory that this can cause probably I'm gonna say there could be sepsis because this isn't like an infection or a disease. Now, necessarily infections is what causes sepsis, not bacteria. Well, bacterial infections can, but like diseases, I don't know. I mean, I think if a disease is bad enough, it could cause sepsis in a way, but I don't think it's like something you would automatically say it's sepsis. And I'm pretty sure it would cause strep, which is very, very dangerous. It can even lead to whooping cough if it's not taken care of fast enough. And there's much more that I have my theory on. My hand. My hand is killing me, bro. I've been working out. If you guys can't notice, I've been really working out recently. I don't know if you can notice right there, but I got this little like red mark on me, bro. I think it's from me working out. This is weird. Why is my hand turning? That's alright. This is red too. I think, the thing is, this arm is sore. I've been working out with this arm a lot, and I think I made it a little bit sore. So yeah, so me been working out recently, it's been making it really, really sore. But yeah, anyway, so I'm pretty sure could be maybe cause sepsis and much more, but we'll have to wait and see. I don't know. And we'll be reacting to another one of these videos, and maybe we'll do a heart attack, like symptom stuff, also tonight, and yeah.
They become infected that way. That could also be a way that this virus can transmit, so both direct and indirect. So when an individual does come into contact with secretions that contain the virus, they either have that virus contact their respiratory mucosa, their oral mucosa, and get infected that way, or they indirectly or accidentally ingest the virus and it enters into their gastrointestinal system. Those are the two ways that virus can get into the body. And once it gets in, it starts to multiply and replicate and enter into surrounding lymphatic tissue. It can enter into surrounding lymphatic tissue in the throat or respiratory system, or can enter into the surrounding lymphatic tissue in the gastrointestinal system as well. And that often takes around 24 hours for it to do that. And as mentioned before, a fecal-oral route of transmission is an important one, especially in children. And the virus can be shed from respiratory secretions or oral secretions or through the stool, and this can last for weeks. So we can often see this being very infectious in patients, especially young children. And what's important to note here is that when an individual becomes infected with this virus, it takes about 3 to 5 days before a patient starts to see symptoms. That is the incubation period.
When you can't get around and it's hard to walk, it just makes you feel like you're worthless.
Oh, I farted.
Now let's talk about the clinical features of hand
That's a shit.
and foot and mouth disease. There is a small or brief prodrome that can occur in this condition. A prodrome is the signs and symptoms that occur before the hallmark findings of the condition.
Now we're
The
getting
hallmark
to the
findings
symptoms.
in hand, foot, and mouth disease are going to be that rash that affects the hands, the feet, and the mouth. So there's going to be certain signs and symptoms that occur before the onset of that rash. These are going to include the following.
Oh, fuck. I did not think that. I did not think a fever would be a sign of this. I mean, a disease, viruses, all can cause this. So, of course, I should have expected it to cause a fever, but to be honest, I never thought it expected a fever. Because fevers are like, I wouldn't say into like the bad, because even a cold can cause a fever. I had a fever of 103 with a cold. I posted it in community post about it. A lot of people are saying I was strong and I could beat it, which I did because I'm so fucking here.
Fever. So a fever that's going to be anywhere from 38 to 39 degrees Celsius. So it's going to be a low-grade fever that occurs for about 24 to 48 hours. Patients can also have a sore mouth or sore throat.
Okay, I mean, of course, bro, we already know it's sore mouth, sore throat. We, honest to people, know that. Because, like, sore mouth and sore throat, whenever you have something like that in your goddamn throat looking like you got egg sacs in it, I mean, damn, bro, you know you got something up with that motherfucker. Like,
Throat. They can also have reduced appetite.
okay, so, like, reduced, that means a lack of appetite, so, oh! So your skin will look a different damn color.
They can have malaise. They can feel generally unwell. Some patients can have abdominal pain.
Oh man. Oh. This gets worse, bro. Isn't malaise a different color of skin? I'm not mistaken. Isn't that like different color of skin?
And some can have nausea and vomiting. And some of the gastrointestinal findings are going to be more likely to occur in cases where the patient's infected with enterovirus 71. So again, these are the prodromal signs and symptoms, and they occur for roughly 12 to 36 hours prior to the onset of the rash. So after that 12 to 36 hour prodrome, we start to see an eruption of a vesicular rash. So the rash can look something...
Oh! Ew! The fuck? Okay, alright, so there's entire, so his tongue, so that means blisters like sores on your arms. Isn't that what monkeypox kind of looks like? It ain't monkeypox, which monkeypox is like is another entire fucking virus. But bro, oh damn, I just realized there's monkeypox. COVID ain't even fucking over yet. But yeah, so this is what your mouth will look like. Your tongue will have like blister-like sores on your tongue and your hands and your feet.
Like this, there can be blister-like sores on the hands, the feet.
Makes sense. Mouth, hand, foot. So hand, foot, mouth disease. Of course. I mean, guys, you should obviously know symptoms of this and like a whole bunch of stuff. You know,
in the mouth.
Like you should freaking know.
Be in the mouth, and especially the posterior mouth. So again, this occurs 1 to 2 days after the fever. So it's important to think about fever, then rash. So hand, foot, mouth disease, we're going to see a fever, then a rash. It's going to occur as vesicles and pustules on an erythematous base. So vesicles are going to be fluid-filled raised skin lesions. Pustules are pus-filled skin lesions, and erythematous means that the skin.
I didn't think a video would make me throw up, but damn. That motherfucking thing can cause all that. Oh, I hate to see the complications, bro. Oh my gosh, bro.
Is reddened. So we can see the rash occurring inside the mouth. So we can see it on the tongue, buccal mucosa, and hard palate. Buccal mucosa is going to be on the insides of the cheeks, and on the hard palate, it's going to be on the upper or the top of the mouth, inside the mouth. So we're going to see the rash occur first inside the mouth, and then it's going to start to occur on other parts of the body later, like the hands and the feet. The hand and foot rash lasts on average 5 to 10 days.
So you're saying if I randomly got this hand, foot, and mouth disease, my hand and foot would look like a blistering hot mess for 5 to 10 days, and I'm already ugly. Having blisters on my arms and stuff is only gonna make that worse. It's only gonna make my ugliness worse. Bro, my skin, bro. Oh. Oh, that looks weird. Whoa. I ain't worried about it, I'm fine.
Days. And some other parts of the body that can be affected with this rash include not only the mouth, hands, and feet, but we can also see it on the buttocks and the genitalia as well.
Oh, no, why'd I have to hear that? I should have expected that, man. I should have expected an inappropriate word to be on my video. There goes my monetization, which I don't even have. Bro, my hand, bro.
So the rash often is going to start out as a macular-like rash. Macular meaning that it starts out more as a flat lesion, and then that lesion is going to start to raise and become fluid-filled. And fluid-filled raised skin lesions are known as vesicles. And then in some cases, the vesicles can become eroded, and we can see erosions on an erythematous halo. That's going to be the terms that are used for this particular type of rash, especially inside the mouth. So this is the stages of this particular type of rash. And some other images of the rash include this image here, around the mouth. We can see on the hands.
Wait,
like so, and we can
bro,
also see
wait.
on the feet.
There is one hell of a way that we can guarantee that this is sepsis. Here, look, ready? Sepsis rash. I'll guarantee you it. Look, ready? Oh, okay, man. We don't need to see explicit shit. Alright, right here. Ready? Now look. Look how close that looks to this. Come on, you can't say that there is not a similar reference to each other. Please say this looks exactly like each other. This right here is darker, and so is this. This is, I don't know, looks like, this is all part of the mouth-foot disease, but still. This looks like an image of sepsis. So maybe that's one of the, end events of these.
As well. And it's also important to note that this rash is not itchy or painful.
Oh, that's a good thing.
Hey, so check it out. This is a emergency sleeping bag. These things normally
Are you
cost
serious
$30
right now,
during
bro?
wintertime, people
I
pay
don't
full
care,
price.
man. I'm trying to watch a video.
So the majority of cases of hand-foot
Alright,
mouth
here we
disease are
go.
going to have those signs and symptoms we talked about before, those prodromal findings, and also that rash, and oftentimes that's going to be it. But in some cases, there can be more severe signs and symptoms and complications that can occur.
Damn,
These include
hyperthermia.
aseptic meningitis.
Oh! I told you something was septic. I told you.
Encephalitis and encephalomyelitis, so inflammation of the brain and spinal.
Oh! I fucking what? Dude, I knew something like this could not be that unharmless, bro. I know that something like this could not be that harmless. I knew there had to be some really bad side effects or complications. I knew. At least it doesn't cause hyperhidrosis. That should have been on a symptom of not so serious, because hyperhidrosis ain't serious.
No cord. Acute cerebellar ataxia, acute transverse myelitis, Guillain-Barré syndrome in some cases, opsomyoclonus syndrome, and benign intracranial hypertension. All of these complications are more likely to occur from infection with intravirus 71. So this is going to be...
Alright, so from this entire video, what I'm getting at is the EV71. Now, EV71, if I'm not mistaken, I have to go back just to check. We're 8 minutes, right? So, it's intravirus 71. So, intravirus 71 can cause aseptic meningitis, inflagitis, and inflammatitis, acute cerebral ectasia, acute transfer meningitis, meningitis, Guillain-Barré syndrome, opsomyoclonus syndrome, benign intracranial hypertension, and benign intracranial hypertension are all these like severe complications of, oh my gosh, I keep forgetting the name of it. Enterovirus 71. So again, you're more prone to get food poisoning or cyanide poisoning and probably getting this shit. So again, don't worry about it.
The virus that causes a more severe clinical presentation. So it's important to recognize this virus. How do clinicians diagnose and treat hand, foot, and mouth disease? So oftentimes it's going to be a clinical diagnosis by history and physical examination, and by seeing whether or not there are multiple cases of this in the community.
Right.
This can be enough to make the diagnosis of hand, foot, and mouth disease. But laboratory investigations can be used in some cases. So this includes viral isolation using 2 swabs, PCR polymerase chain reaction. This can be helpful in distinguishing between intravirus 71 and other viruses that may be causing hand, foot, and mouth disease, and serologic testing in some cases looking for antibodies. So treatment of this condition is going to be often supportive. It's going to be a self-limiting disease in most cases. It often resolves on its own within 7 to 10 days. And the supportive treatment is often going to be with fluids, so giving the patient lots of fluids. There are some other factors that should be implemented as well, and these include avoidance of certain foods that may irritate the lesions. So because there are so many lesions within the mouth, it can be very difficult for patients to eat certain foods. So avoidance of very hard foods, very spicy foods, or other irritating foods is going to be important as well. So often a patient will have very soft, chewy foods while they have those lesions in the mouth. Antipyretics are going to be important, so that can help reduce the fever. Pain relief in some cases, so this can be with acetaminophen, ibuprofen, and mouthwashes. Certain mouthwashes can be used to help with those painful lesions in the mouth. And in some cases, if the case or the condition is more severe, IVIG therapy has been used in some cases, and certain antiviral medications have been used to treat enterovirus 71 because of its severity.
I knew you were going to pop up with
If you
videos.
did, please like and subscribe for more lessons like this one. And as always, thanks so much for watching, and hope.
Alright. Oh, look at this. Look, as the devil just speak. That came out wrong. I'm sorry, God. I did not mean to put the devil in any of the words I was saying. I'm sorry, God. I did not mean to say the devil's name. I'm so sorry. Can you please forgive me for it? I did not mean to have the devil's name in what I was saying. I am so sorry. I apologize. Can you please forgive me? Anyway, everybody, if you did enjoy today's video and found my reaction a little bit helpful, I'm hoping that you guys will check out some of my other videos, and thank you for liking and subscribing. And without further ado, I'm going to try to get more jacked up because right now I got no muscle showing on the camera, but still, I hope you enjoyed today's video. If you're new, please like, subscribe, comment, favorite, share, and make sure to leave me know what reaction you want to see next of health-related content. I will be posting one more health-related video of reaction and a heart attack one also tonight. So, see you all, I said again, in the next video, everybody.